Next slide. Yeah, and in the toolkit, of course, we also included the policy documents that Christoph referred before. So the policy paper that is towards a WHA resolution on rehabilitation. It is available both in English and in French. We are going to share a Word version of this document in order to you, if you wish, to put your organization's logo next to the GRA logo. And here it's really the document where we tried to put together a list of reasons why a WHA resolution on rehabilitation is needed, and a list of topics or commitments that such a resolution should contain. And the other policy document is the report, Rehabilitation for the Realization of Human Rights and Inclusive Development, again available in English and in French, which is a report that we co-produced in 2019 and that serves really, I would say, as a basis to build this common narrative around rehabilitation. And as Christoph said, ideally, at least for the policy paper, it would be very good to have some printed copies when you meet with institutional interlocutors to hand them over to them. Next slide. And in the toolkit, really as an integral part of it, there is also a monitoring tool. So we put together a very simple online table on a Google spreadsheet that will help us keep an overview. Here is a screenshot of the table. This table would provide an overview of actions undertaken in different countries by different organizations. So it will be very important that all of us who are undertaking actions, advocacy actions, keep it up to date. And also don't delete what others have put in there. As you can see, there are, it's very easy table. We didn't plan anything too complicated. It's structured on 5 columns. The first one, it's a list of all the member states that sit in the WHO Executive Board and on which, of course, we focus our advocacy. According to the country where you are based, then in column 2, you will indicate the organization in the country, but also the contact person responsible for advocacy on this topic. The third column, it's really about providing the update on the advocacy undertaken in that country. So you should mention what organization undertook the advocacy, what type of action. Was it just about sending a letter? Was it about already having a meeting? Or, I don't know, hosting a seminar in which you invited also governmental officials to speak about it? Towards whom? So it would be important also to mention who you reached out to. Is it a rehabilitation specialist within the Ministry of Health, or a delegate who is responsible for WHO relationships, whatever, and the outcome, if any, already the outcome of this action. So in general, I would advise to be concise. We don't need to have all level of details in this table, but the key information should be there, and are those that are listed in the gray row that really provides guidance on how to fill in the table. The fourth column is about key interlocutors, contacts that you have in the country. So I don't know, maybe HI in Indonesia could put there that the key contact person is the rehabilitation director of the Ministry of Health. Someone else, CBM in the same country, could put another contact person, a governmental official they know previously, etc. And the last column, it's really for you to leave open comments, ideas, questions, and from our side, from GRA Secretariat and myself, it's also a column that we will really look at to come back, maybe if there are any pressing things to be further discussed. I see that there's a question. If it's related to this table, maybe we can take it now. for Vanessa?
Yes, hi. It's not related to the table. It's just I was following the Boya instructions. It will be after your presentation is finished.
Okay, okay, perfect. Okay, so this is the table. The advice that we have, it's really to keep it up to date, and it's really to have an overview, but also the purpose is to try to understand who is willing to engage in advocacy at the national level to create meaningful connections. So the second column, organizations in the country, would provide an overview of, let's say, in Bangladesh. HI puts the name there, but maybe there's also the Association of Physical Therapists that is present in the country. They put it in the table, and this would facilitate contacts. The idea is really to have as much as possible, and in countries where there is the opportunity, joint advocacy efforts within the GRA at least. But of course, also external partnerships are encouraged. So if you have contacts or already existing partnerships, maybe with patients' organizations, women's associations, other professional rehabilitation professional groups that are not part of the GRA, but that you feel would be meaningful advocate together with you in this advocacy, it would be really important to reach out and to show that rehabilitation is a matter of interest and concern by a variety of different groups and stakeholders. Next slide, my last one. It's just to show you that we are available. Of course, this toolkit is just one way of supporting, very practical, let's say, with some tools that you can consider ready to use, but that we also remain available for further support, which could be a Skype call if there are any questions, or support to maybe identifying what other GRA members are in the country if you were not able to find out, or yeah, really to accompany you in this. We remain, both myself and the Global Rehabilitation Alliance Secretariat, we remain available, of course. And I think that for me, it's that's about that, and we can open to questions and comments.
So first, please, thank you, Valentina and Christoph, for the presentation.